अस्सलाम वालेकुम, माई सेल्फ हमजागोस अ डीवीएम फाइनल ईयर स्टूडेंट। इमेजिन करें कि एक मेयर है जो कि अपेरेंटली कम्प्लीटली हेल्दी है। कोई साइन ऑफ पेन नहीं है, कोई बिहेवियल चेंज भी नहीं है और एस्ट्रोसाइकिल भी कम्प्लीटली नॉर्मल है। बट डीप डाउन एक ट्यूमर उसकी ओवरी पे परसिस्टेंटली ग्रो कर रहा है विदाउट शोइंग एनी काइंड ऑफ साइन, which is an alarming condition. Well, today's case study is something similar. The title of the case study is Luteoma in Mare. Luteoma is a type of ovarian tumor which is a benign neoplastic proliferation of the luteal cells. Luteoma is a very underdiagnosed condition and has only 3 previously documented cases before this case study. This case study was published by a team of University of Kentucky in American College of Theriogenologists. Well, ovarian tumors are very uncommon, but mostly they are diagnosed as granulosa cell tumors based upon the histopathological examination along with hormonal profile. In these conditions, there is marked variation in the hormonal profile of mainly anti-Mullerian, testosterone, and inhibin B hormone. Luteoma has been observed in many species, like in humans, it is mostly pregnancy-related and secrete androgens, but right after the parturition, it regresses spontaneously. In cattle, it secretes progesterone, resulting in a prolonged diestrus, often perceived by owner as an anestrus, but its incidence is very low, in which there is only a single case reported in which there was abdominal distension along with hyperadrenocorticism. Also, there was no correlation observed between these two conditions. Now, moving towards the mare, in previous case studies, the mare showed aggressive stallion-like behavior along with increased anti-Mullerian hormone and inhibin B hormone, but there was no changes in the testosterone level. But this case study has something unusual, so let's just move towards our case study. Our case study is about a 5-year-old maiden recipient mare in a commercial embryo transfer. The mare had a successful embryo transfer, but after the ultrasonographic examination and rectal palpation, they observed the development of an anembryonic structure. During this period of time, the mare had subsequent normal estrocycles and ovulated normally. But over the period of next 2 months, they observed that there was persistent growth of follicle on the left ovary. So let's just move towards their diagnostic. On day 1, they observed a 35 millimeter follicle on the left ovary along with corpus luteum, while right ovary had a 20 millimeter follicle. There were no uterine edema or intraluminal fluid, and the cervix was closed and toned. They performed this examination to go for the PGF2 alpha treatment so that they can perform the next embryo transfer. After 2 days of the PGF2 alpha, they performed the ultrasonography and observed that the follicle on the left ovary had grew up to 52 millimeter and did not ovulate, but the follicle on the right ovary was about 32 millimeter. Again, there was no uterine edema or intraluminal fluid, and the cervix was also closed. Then they performed the regular ultrasonographic examination, and on day 7, they observed that the follicle on the right ovary had grew up to 48 millimeter with firm tone. There was moderate uterine edema, and that follicle ovulated normally. But interestingly, the follicle on the right ovary grew up to 52 millimeter and did not ovulate. After 2 days, they again performed the ultrasonography, and the left ovarian follicle was about 92 millimeter, while the right ovary was cycling normally. Over the period of next several days, they observed continuous growth of the left ovarian follicle, but the right ovary was cycling normally. On day 30, they performed the ultrasonographic examination, and the follicle on the left ovary had grew up to 152 millimeter. But there were certain changes in the inner contents of the follicle. Previously, it was anechoic with shorter brim, but at this point of time, it was hypoechoic contents along with thickened brim. They go for the hormonal profiling and observed that there was increased testosterone level, anti-Mullerian hormone, but the inhibin B level was completely normal. So, based upon the continuous growth of the follicle along with the hormonal profile, they decided to go for the ovariectomy. Before ovariectomy, as you can clearly see here, the brim of the follicle is thickened and there are hyperechoic thread-like structures present inside the follicle. So they go for the unilateral left ovariectomy through the flank approach and remove the only affected ovary. In ovary, they drained about 500 ml fluid, and the ovary had stromal hemorrhages and well demarcated mass. To confirm the diagnosis, they sent the ovary for histopathological examination. Histopathological examination confirmed that it was a luteoma because they observed polygonal cells with finely vacuolated to granular eosinophilic cytoplasm and round nuclei. Also, there was no mitotic figures, which confirms that it is a benign proliferation, not a metastatic. After the ovary, after the surgery, the mare developed a incision site infection, but they treated it with antimicrobial therapy using ceftriaxone hydrochloride, and the uh, Cyclicity on the right ovary began as usual. So what are the learning points for us in this case study? The first thing is the unique behavior. As I mentioned, in the previous case studies, they observed aggressive stalling-like behavior, but there were no behavior changes in this case study. One explanation for this is that they might remove the ovary before the behavioral changes were developed, but it could be that the behavioral changes are not only due to the testosterone, but also some other factors are also responsible for this condition. The second is the treatment decision. In the previous case studies, they performed the bilateral ovariectomy because they were not sure that जानवर जो है वो अपनी नॉर्मल ओवरी के ऊपर साइक्लिसिटी को रिज्यूम कर पाएगा कि नहीं. द थर्ड थिंग इज द डायग्नोस्टिक चैलेंज. आपने देखा कि ग्रेनुलोसा सेल ट्यूमर्स और ल्यूटियोमा की जो हार्मोनल प्रोफाइल है वो काफ़ी ज़्यादा मैचिंग कर रही है. सो यू शुड नॉट रिलाई ओनली ऑन द हार्मोनल प्रोफाइल बट ऑल्सो गो फॉर द हिस्टोपैथोलॉजिकल एग्जामिनेशन फॉर द कंफर्मेटरी एंड एक्यूरेट डायग्नोसिस. लास्ट इज द फ्यूचर फर्टिलिटी. प्रीवियस केसेस में, as I mentioned earlier, उन्होंने bilateral ovariectomy की because they were not sure about the future fertility. But in this case, they performed the affected ovariectomy and cyclicity was normal on the contralateral. So these are the main learning points of this whole case study. The first is the hormonal aberration, that in previous case studies and in this case study there were significant changes in the hormones, and granulosa cell tumors and luteoma have similar hormonal profiling, so you must go for the histopathology for accurate diagnosis. Second is the normal cyclicity possible, that this case study is a proof that if you only remove the affected ovary and do not remove the contralateral ovary, thus cyclicity will resume normally on the normal ovary. Third is the behavioral absence. In previous case studies, they observed the changes in behavior, like aggressive stallion-like behavior, but there were no behavioral changes in this case study. So this might not be an pathognomic symptom for this condition. Thank you.